Feeding with a nasogastric tube. If a small baby cannot feed enough by mouth, breast milk can be given through a nasogastric tube. This video will show how to feed a baby with a nasogastric tube. Check the baby's chart to determine the amount of milk for each feed. Our 4-day-old baby weighs 1.7 kilos. He needs 20 milliliters of breast milk every 3 hours. Adjust the amount if the baby also takes milk by cup or breast. Have the mother wash her hands and express her milk into a clean cup. Then, encourage her to put her baby to her breast. This practice time at the breast helps babies develop their feeding skills more quickly and improves the mother's milk production. Feeding with a nasogastric tube requires close attention to the baby. Always check that the mark on the tube is visible at the edge of the nose. This assures that the baby will safely receive the milk in his stomach. If the tube has moved, check that it is in the stomach. First, listen for air entering the stomach. Then, check for gastric contents as you pull back on the syringe. Now, tape the tube more securely. Teach the mother how to draw up the volume of milk her baby needs. Encourage her as she learns to feed her baby in this new way. Have her put the milk into a cup, then remove the barrel from the syringe. Have the mother hold her baby in a breastfeeding position on her lap or skin to skin. Pinch off the tube, open the end, and attach an empty syringe without the plunger. Now, pour the baby's volume of milk into the syringe. Release the pinched tube and hold the syringe just above the baby to allow the milk to flow into the stomach. Watch again. Pinch off the tube, open the end, attach the empty syringe. Then pour the baby's volume of milk into the syringe. Release the pinched tube and hold the syringe above the baby to let the milk flow. If the flow does not start, gently insert the plunger, but do not push. Or try covering the top of the syringe barrel with your thumb and release. Both of these methods can help start the milk flowing. The milk will move slowly into the baby's stomach. Each feeding should take about 10 to 15 minutes. Slow the feeding by lowering the syringe if the baby spits up or chokes. When finished, remove the syringe and cap the tube. A common mistake is pushing the plunger to speed up the feeding. This can be dangerous. The baby can vomit and possibly breathe milk into the lungs. Wash the feeding syringe and cup with soap and water for the next use. When the baby can effectively breastfeed, remove the tube. Remember, check the chart daily for the volume of milk to be fed. Check placement of the tube before each feed. Let the milk move slowly into the baby's stomach over 10 to 15 minutes.